Hello everyone, my name is Grace and today I will be presenting my project proposal based on pediatric needle insertions and providing non-pharmacological interventions for the child. Okay, so for this project proposal, we see that needle stick procedures are definitely common in children. We also see that needle stick procedures are a routine for us nurses. However, when it comes to the child, this child may experience a lot of fear, a lot of anxiety, a lot of pain and resistance. So as a nurse, we do play an important role in their care, because if we do not manage the situation properly with the child can create a fear and also not allow us to do their care for future visits. My question for this was, in pediatric patients undergoing venipuncture or intravenous procedures, how do non-pharmacological interventions such as buzzy device, code and vibration, procedural preparation, and distraction compare with regular standard care, can affect pain, fear, and anxiety during procedures over an 8-week implementation period? The question here helps us guide the focus that the project helps evaluate the effectiveness of interventions. And also, we see that the population here is with pediatric patients. Our interventions will be based solely on non pharmacological measures, and our outcomes are hoping to reduce pain, fear, and anxiety during an 8-week period. Now, children may not be aware of the procedures that are going on around them. Children also have different developmental stages that can affect their pain response. So, what may work for a child, such as an infant, where we swaddle them, may not work for a elementary 5-year-old kid, such as comforting them in other ways. We need to remember that each child comes with a different age, and we need to remember also that the child may not have their pain response the same way. Nurses need to also use their appropriate age appropriate interventions. For this project, I looked up different studies, and each study I will hope to break down in order for you to understand. With each study, the support was used with Buzzy device. Buzzy device is a device that is shaped like a bug. It's a plastic bug that is about this size, and underneath the bug there is ice pack, and there is also a vibration that comes with it. So whenever we have an insertion, we will either put that device above or below the insertion to help distract the child. So that's one device that was used. Cold therapy was used, vibration was used, distraction was used, and preparation. For the first study with Paris, we see that it's a systemic review. Paris used interventions such as Buzzy, code application, vibration, distraction, virtual reality, breastfeeding, positioning, and gentle touch. He concluded that the use of these interventions did reduce the pain for the child. For Simone also used the Buzzy device, and it had lower pain scores. For Zoe used 130 children. And these children range from 2 to 7 years old. So there was a different age for this one. With each group of children, there was different groups. One was a regular control group with no intervention. The other one was an external code group. The third group had just vibration alone, and the fourth group included combined therapy of code and vibration. With this study, it concluded that interventions that were used created a reducing impact in pain versus a control group. For our last study, we see the Carmanley and Park show us that interventions do improve cooperation during procedures, and the interventions that we use are not as invasive, they're low cost, and they're low risk interventions. However, Even though we have these interventions, the consistency is still not there. The nurses may not use these interventions because of lack of time, because supplies aren't at hand, the protocol may not be there or enforced, and the documentation may not show it to be used either. We do see that if there is a structured nurse led protocol, this can help improve the consistency and the support for this evidence based and family care. This proposal also is able to address the gap by applying a simple nurse led protocol that can help with needle related procedures and reduce pain, distress, and improve cooperation. The project objectives are SMART objectives, which are measurable and realistic. For the first couple of weeks, we will educate 90% of the nurses and create an education session about the protocol being used. For the next couple of weeks, we will document the interventions used in pain, and there will be an 80% of eligible procedures. These procedures will be tailored for the developmental stages and age of the child. For the next couple of weeks, we will reduce the pain scores by 20%. And lastly, we will improve our caregiver satisfaction of both the parent and the child by 15%. Our methodology and intervention with this project is that it uses a quality improvement evidence-based practice design for pre and post implementation and comparisons. This intervention is also a nurse-led pediatric comfort protocol, which improves the current nursing practice rather than testing medications. It will also use buzzy, distraction, vibration, and caregiver support to help assess each child's developmental age, anxiety, and preference. Here are just some of the comfort protocol that we will be using. Buzzy device, cold and vibration combined, as well as distraction. We will try to position the child and provide the caregiver at bedside. We will also use breathing techniques to help ease the child's anxiety, and we will use the appropriate pain scales according to the child's age. Our implementation plan is also aligned with our project objectives mentioned earlier. Our plan will be done in weeks, in a span of 12 weeks. For the first 2 weeks, we will include a planning and supply review. This review will help guide towards leadership meetings, gather supplies, and review workflow. And then for our weeks 3 and 4, it'll involve our staff education and training, considering the protocol. For weeks 5 and 12, or weeks 5 through 12, the protocol implementation will take place. There will also be documentation and interventions and use of pain scores. The staff will also be provided with weekly staff check-ins to help identify any barriers such as time, meditation, supplies, or any documentation challenges. Some potential barriers that we may face, however, are the lack of supplies, but this can be provided with easy access, any limited time or documentation which can be used with reminders or a providing checklist for us, any child or caregiver anxiety, but this can also be flexible because of intervention selection. After finishing our proposed interventions, our evaluations will be based on compared pre and post pain scores from the children. We will also track any interventions and education completion, and we will reduce any pain and distress from the procedures. We will also improve the patient care and satisfaction, and we will see how the success was measured with the children, caregivers, and nurses. Through this project proposal, our expected outcomes and implications will be to reduce the pain and anxiety in children, also have a better cooperation from the children and caregiver, and be able to have a good satisfaction and patient care. That way the family can become stronger and more consistent whenever we have to come in the picture. To sum it all up, pediatric needle insertions can be quite stressful, and the evidence used helps support that we can definitely change the child's perspective and pain level. So we need to remember the importance of being with the child and being able to incorporate these procedures. We also need to see that every children comes in different developmental stages and to be able to use the appropriate structured intervention for the child. We also see that it is a family-centered nursing care and that consistency and pediatric pain management do matter with the child. Thank you for listening, and I hope this created a difference into perspective with pediatric care.